Now, I'm going to give a brief overview of the portion of artificial intelligence that we will be focusing on when it comes to improving evidence-based treatments. So the first area is machine learning. Machine learning is a branch of AI that is focused on building applications that learn from data and improve their accuracy over time without being programmed to do so. Now, in machine learning, this usually is done in a human-supervised manner, which requires the input data to be labeled so that the machine learning model can understand and learn from the data. The next area is deep learning. And deep learning is a subset of machine learning, and it is essentially a more complex version of a machine learning algorithm that can actually be used with unstructured data to learn. Now, what is post-traumatic stress disorder, also known as PTSD? So PTSD is a mental health disorder that develops in some people after extremely traumatic events, such as combat, crime, an accident, or even a natural disaster. It is a disorder that affects millions of people. In fact, there are 8 million current adult cases in the United States. That is about 1.37 times the entire population of the state of Wisconsin. The disorder also has 636,120 possible different symptom combinations. This creates many different problems when it comes to knowing if you are suffering from PTSD or knowing how to most successfully treat it. The first evidence-based treatment we'll be looking at is called cognitive processing therapy, or also known as CPT. CPT is considered a psychoeducation therapy, and the goal of this treatment is twofold. First, it aims to help the patient become more aware of the relationship between their thoughts and emotions. Next, it teaches the patient to identify automatic thoughts that may be maintaining their PTSD symptoms. So this usually begins with the patient writing a detailed account of the worst traumatic experience that they've had, in which the patient will end up reading this detailed account the next session to try and break the pattern of avoiding thoughts and feelings associated with their trauma. Their therapist will then use different methods, such as Socratic questioning, to help the patient question his or her unhelpful thoughts about the trauma. Once the patient has developed skills to identify and address this unhelpful thinking, the therapist will then help the patient develop the ability to modify his or her negative beliefs, and then that have arisen from this traumatic experience. Now, this can be used in group or individual settings and has been proven to be one of the more successful group-oriented treatments. Our next evidence-based treatment is called prolonged exposure therapy. And this is also considered a psychoeducation therapy. It usually begins by having the therapist teach the patient various breathing techniques, which will be helpful when negative emotions and feelings associated with the trauma arise. The therapist will then follow up by beginning the process of exposure. Now, this usually occurs in two different methods. The first method is called repeated imaginal exposure. This occurs in session with the patient describing the event in detail in the present tense with the guidance from the therapist. Together, patients and therapists discuss and process the emotion raised by the imaginal exposure to the trauma. The next technique used is called in vivio exposure. Now, this is usually assigned as homework for the patient, and it basically encourages them to confront their feared stimuli outside of therapy. The patient is encouraged to challenge him or herself, but to do so in a graduated fashion so as to experience some success in confronting their feared stimuli and coping with the associated emotion. Now, this is very anxiety provoking for most patients and is one of the most difficult parts of dealing with their trauma. Think of this as the classic situation of facing your fears head on. This treatment is almost always done individually. The combating of personal fears in situations of avoidance can be really difficult in groups. So what are the current issues with evidence-based treatments? Well, first, they require access to a therapist. This meaning that most of the progress made by patients during these evidence-based treatments is when they are with their therapists in session. Now, this is not possible all the time, and if a situation were to arise, say when the therapist is sleeping or if they are busy with another patient, then it might be difficult for the patient to deal with that on his own. And that could even result in a backtracking of their progress of their treatment. Next, there's this difficulty finishing treatments for patients. Now, this is most prevalent with the prolonged exposure therapy, which has nearly an almost 50% dropout rate. So the success rates for cognitive processing therapy and prolonged exposure therapy are really high. They're about 86%, but those are just the rates of people who actually finish their treatments. And then finally, you have the cost. And the costs, as you can see, for cognitive processing therapy and prolonged exposure therapy are around both $1,400 for 12 sessions. And this is just basically one segment of 12 sessions. And this could extend. Somebody could need 12 more sessions, in which that's another $1,400. So the price of these treatments can add up really quickly. Now, the first way that artificial intelligence could be used to improve the current evidence-based treatment plans would be through a digital health app. Now, I need to stress that this digital health app would not be a substitute for evidence-based treatments. It would be a supplement to the treatments that the patient could use with their treatment plans. So this digital health app would allow for 24/7 access to care. So in those moments where they don't necessarily, the patients don't have access to a therapist, they could use this app, input their information, whether they have questions or if they're having an episode with regards to their PTSD symptoms. And the app would either be able to give them the information that they require or at least outline short-term strategies to deal with symptoms that they're experiencing. The app would ideally be low cost for the patients to use. The startup cost for the app might be a little high, but once the app was created, being able to use it would not cost very much money. And then finally, it would provide widespread access to care. This would basically allow anybody with a smartphone or a computer or even access to the internet to be able to have some sort of care when it comes to post-traumatic stress disorder. The second way would be preemptive diagnoses. In many cases, people don't actually know they have post-traumatic stress disorder. Maybe their symptoms aren't intense enough, or they even wanted to personally just deny the fact that they are showing the symptoms of this mental health disorder. So being able to preemptively diagnose it would allow for quicker treatments and therefore less severe symptoms from the disease itself. Now, there are already currently two ways that this is being implemented mainly. Would be the combined machine learning and MRI data. So this would obviously require somebody to have an MRI, but then through this program, the machine learning algorithm actually has a 92.5% success rate of identifying if somebody has post-traumatic stress disorder or not. It's very successful, but also requires an MRI. The other one that's kind of being implemented would be text mining. So basically, it's a program that goes through somebody's texts and is able to analyze and pick up certain phrases and words and identify phraseology that could show that somebody has post-traumatic stress disorder. And this has a little bit less of a success rate, but it could also be applied on pretty much anybody with a smartphone. And finally, you get that smartphone and tablet evaluations, which is actually proven to be just as successful, if not, and a lot quicker than actually going in to be evaluated by a physician. And this is something that could actually be incorporated into the digital health app as well, and would be accessible to everybody, and would provide for wide-ranging testing ability for post-traumatic stress disorder. Now, to show a few of the ways that artificial intelligence could be used to improve current evidence-based treatments, we're going to look at a case study with Terry here. So Terry was a 42-year-old earthquake survivor. He had PTSD symptoms for 8 years without seeking treatment. He didn't seek any treatment because he thought that he could push through the symptoms on his own, and he essentially was trying to ignore the fact that something was going on with him, that he was suffering from his earthquake experience. And the symptoms that he was experiencing were avoidance, unwanted intrusive thoughts, and nightmares. Now, after Terry mustered up the courage to seek out treatment, he ended up going through a 12-week treatment plan of prolonged exposure therapy, and it ended up being successful. He saw all great reduction in the experiencing of his systems and the negative effects from his post-traumatic stress disorder. However, it took 8 years for him to seek out treatment, and now that's 8 years of suffering that could have been avoided. Now, how could artificial intelligence been used in this situation? Well, if the digital health app did exist, Terry could have downloaded the app on his phone, and when he started to experience some of the symptoms and these negative thoughts arising from his earthquake experience, he could have felt the security of asking these questions to the app in private, and received information on what to do and the likelihood of him actually having post-traumatic stress disorder. And if the diagnosis technology was there, or the algorithm was created, he actually could have done a diagnosis from his own phone. And maybe if he had seen and done this diagnosis and found out that he had PTSD 8 years earlier, he could have avoided the 8 years of pain and suffering that resulted from his PTSD.